It's funny how we just sort of accepted that finding out what's wrong with our bodies requires, well, a certain level of violence.
Yeah, that's a pretty strong word for it, but you're not wrong.
Right. I mean, you go to the doctor, and to get real answers, they usually have to break the skin barrier.
Mm-hmm.
You're dealing with blood draws, tissue biopsies, spinal taps. It's highly invasive.
We really have been conditioned to believe that precision medicine requires pain or, at least some significant discomfort along the way.
Exactly.
And beyond just the physical toll of that, those procedures are expensive. They cause a lot of anxiety for people.
Oh, totally.
And they're really just completely unsuitable for the kind of daily, continuous monitoring that we'd actually need to catch a disease in its absolute infancy.
It's basically like if you wanted to know what your neighbors were eating for dinner, so you just like kicked down their front door and stormed right into their kitchen.
Yeah.
Like a total home invasion.
Yeah.
When really a far more elegant solution would be to just, wait and look at the daily biological trash they've already put out on the curb.
That is a very vivid way to put it, but honestly, biologically speaking, it's entirely accurate.
I tried.
No, it's true. The body is constantly discarding the chemical evidence of what's happening inside its cells.
Which perfectly brings us to our mission for this deep dive.
Yeah.
Because we're asking, what if we could replace all those needles and scalpels with something you literally flush down the toilet every single day?
It's a game changer.
It really is.
Yeah.
So we are looking at this incredibly comprehensive scientific review. It's titled Urine, a new promising biological fluid to act as a non-invasive biomarker for different human diseases.
Quite a mouthful.
Very catchy, yeah. But the goal here is to really understand how this totally ordinary, infinite resource is poised to map out your internal health and basically revolutionize early disease detection.
And I think when we say, map out your internal health, we are really talking about mapping the entire human body.
Not just the bladder.
Exactly, not just the urinary tract. But to really understand how that works, we probably need to establish what a biomarker actually is first.
Let's do it. What's the definition?
Well, think of a biomarker as like a measurable molecular breadcrumb.
Okay, breadcrumbs.
Yeah, it's any biological molecule that indicates a normal physiological process or the development of a disease or even just how your body is responding to a medication.
But historically, doctors usually look for those breadcrumbs in the blood.
Right.
Right? Like that's why the phlebotomist is almost always your first stop at a clinic.
They do, yeah. But urine is actually the ideal specimen for a lot of reasons.
Okay. Why?
Well, for one, it's naturally produced by the kidneys, so it's completely painless to collect.
Definitely a plus.
Right. And it's available in large quantities over time. You don't need a trained clinician with a needle to gather a sample.
Anyone can just pee in a cup.
Exactly. But the real magic, honestly, lies in the mechanism of how urine is created in the first place. Your blood is continuously filtered through your kidneys. So the kidneys act as the body's ultimate purification plant.
Ah, so because the blood is circulating literally everywhere, picking up chemical signals from every single organ, when it finally goes through that kidney filter, all those disease-associated molecules basically just end up in the urine.
Precisely. That's exactly it. So while urine is about, 91 to 96% just water, that remaining fraction is a complete biological goldmine.
Wow.
It contains thousands of metabolites, proteins, peptides, nucleic acids, hormones, carbohydrates, lipids. I mean, it's a highly detailed chemical ledger of everything happening inside your cells at that exact moment.
Okay, but wait. We've been peeing into cups at the doctor's office for decades.
Yeah.
Right. Usually it's just to check for a UTI or maybe like glucose levels if they're worried about diabetes.
Yeah.
What makes this a new frontier all of a sudden?
It's a massive technological leap.
Oh, so it's the machines reading it.
Yes. Until recently, we just didn't have the tools to read that chemical ledger in full detail. We were essentially looking at this vast microscopic world with a basic magnifying glass.
Oh, yeah, that does.
But today, thanks to these huge recent advances in proteomics, which that's the study of all the proteins in a cell,
Right.
along with metabolomics, genomics, and highly sensitive mass spectrometry, we can now detect these molecules at incredibly trace levels.
Mass spectrometry, that's the one that weighs things, right?
Exactly. It acts like this incredibly sensitive molecular scale, weighing individual molecules to identify exactly what they are. So we're seeing things we simply could not see before.
I do have to play devil's advocate for a second here, though.
Go for it.
Because my biological receipt looks completely different depending on what I do on any given day.
Right.
Like if I drink a gallon of water, it's totally clear. If I eat a bunch of asparagus, it's, smells weird.
Whoa.
Or beetroot changes the color.
Oh, absolutely.
Doesn't my daily lifestyle just totally scramble the data for these highly sensitive machines?
That is actually the single biggest hurdle in this entire field.
Okay, so it's a real problem.
Oh, yeah. Hydration, diet, metabolism, physical exercise, and even just your environmental exposure completely shift the composition of your urine.
So how do they fix that?
It brings up this really vital concept of standardization. For this to work in widespread clinical applications, science basically has to establish standardized baselines that account for all those lifestyle factors.
Meaning they have to figure out the difference between, like, a protein spike caused by my heavy morning run versus a protein spike caused by early-stage kidney failure.
Yes, exactly that. Researchers are having to build massive data sets to basically filter out the biological noise of a heavy workout. Or, that beetroot salad you mentioned.
Wow, that sounds like a lot of data.
It is. But once we crack that standardization code, the diagnostic possibilities are vast. Because, like we said, urine is filtered blood, so it carries secrets from the furthest, most protected reaches of the body.
Okay, let's actually follow that blood flow then, starting at the very top.
The brain.
Yeah, the brain. The review spends a lot of time talking about Alzheimer's disease.
It does. Alzheimer's is a prime example of how systemic this fluid really is.
Oh.
We've actually discovered that elevated levels of specific proteins, namely beta amyloid and tau proteins, can be detected in urine.
Wait, beta amyloid and tau?
Yeah, and to understand why that matters, you have to know that Alzheimer's is characterized by beta amyloid proteins clumping together into these plaques.
Right, I've heard of the plaques.
Yeah, and then the tau proteins twist into tangles, and these physically destroy the brain's neurons.
Jeez.
What is truly fascinating here is that the levels of these proteins in the urine correlate positively with the extent of cognitive impairment the patient is experiencing.
You mean the worse the cognitive decline, the higher the concentration of these proteins in the urine?
Exactly. It tracks the severity of the disease.
Wait, hold on. I'm stuck in the mechanics of this.
Okay.
The brain has a notoriously strict security system, right?
Oh.
The blood-brain barrier. It's literally designed to stop things from getting in or out of the brain to protect it from infections. So how are these highly specific brain proteins making it past security, surviving the journey all the way down the body, and ending up in a plastic cup?
It's a great question, and it's a testament to how interconnected our circulation is.
Okay.
The blood-brain barrier is strict, but it is not impenetrable, especially when disease processes actually begin to break down those cellular structures.
Oh, so the disease weakens the barrier.
Exactly. When those neurons degrade in Alzheimer's, the cellular debris, these beta amyloid and tau proteins, they have to be cleared out somehow.
So where do they go?
They enter the cerebrospinal fluid, which bathes the brain and the spine, and that fluid eventually drains into the systemic blood circulation.
And once it's in the blood?
Once those proteins are in the blood, the kidneys just treat them like any other waste product. They get filtered out and excreted in the urine.
That completely changes the patient experience. I mean, imagine a world where avoiding a spinal tap is possible,
It would be huge.
where a doctor doesn't have to insert a long needle into your spinal canal to draw out that fluid. It's agonizingly painful from what I hear.
It really is. And it's not just Alzheimer's that we're seeing this with. The research shows Parkinson's disease has a very similar marker.
Oh, really? What's the marker for Parkinson's?
For Parkinson's, we look at a protein called alpha-synuclein. Just like with Alzheimer's, the concentration of alpha-synuclein in the urine directly correlates with the degree of motor impairment.
So as the symptoms get worse, the marker goes up.
Right. When the dopamine-producing neurons degrade in Parkinson's, that alpha-synuclein basically spills over, hits the bloodstream, and gets filtered right into the bladder.
That's incredible. And the review also mentions ALS, right? Lou Gehrig's disease.
It does. In ALS, the motor neurons themselves are breaking down.
Okay.
And when that happens, structural proteins from inside the neurons leak out. We're talking about things called neurofilament light chain, or NFL.
Not the football league.
Right, not the football league. And also phosphorylated neurofilament heavy protein.
So detecting those in the urine.
It could lead to early diagnosis for a disease that is notoriously hard to catch before significant muscle weakness sets in.
Which is so crucial for ALS.
Exactly. And we're also seeing markers for multiple sclerosis.
Wow. MS too.
Yeah, so in MS, the body's immune system attacks myelin, which is the protective insulation around your nerve fibers.
Oh.
When that insulation breaks down, myelin basic protein just sheds straight into the urine.
This review even mentions brain tumors. Like glial fibrillary acidic protein shows up when there's a malignant brain tumor.
Yes.
So the blood is picking up all the cellular debris from the brain and carrying it away. But, before that blood even gets to the kidneys, it has to travel through the lungs to get oxygenated, right?
It does.
Does that mean respiratory distress signals are also traveling down to the kidneys?
Absolutely. Asthma is actually an excellent model for understanding how this works.
Oh, how so?
Well, asthma involves severe airway inflammation, right? When you have an asthma attack, specialized white blood cells called eosinophils act like first responders.
Oh, wait.
They rush to the lungs and undergo what we call a respiratory burst.
A respiratory burst? That sounds intense.
It's essentially them releasing chemicals to fight off perceived threats in your airways.
And that chemical battle just leaves a physical trace behind.
Exactly. It creates a byproduct called bromothyracine, along with another molecule called leukotriene E4.
And let me guess, these make their way into the bloodstream.
They do. They make their way into the blood and straight down to the urine. The levels of these molecules indicate the severity of the asthma, and they can actually predict future exacerbations.
Wait, predict them?
Yes, especially in patients who are intolerant to aspirin.
So the urine essentially tells you a lung attack is coming before the lungs even fully seize up. That's wild. It gives you hard, quantifiable molecular data rather than just relying solely on how the patient says they're breathing or, a doctor listening for subjective wheezing sounds through a stethoscope.
Right, it's objective data. And we see a similar process with bronchitis and viral lung damage, too.
What's the marker there?
They use a marker called club cell secretory protein, or CC16. When a virus attacks your lungs, it damages the lung's epithelial barrier.
The mechanism there just makes me think of having a leaky roof.
A leaky roof. I like that.
Yeah, like the storm damage happens upstairs. In the attic of the lungs, the barrier breaks.
Yeah.
But because of gravity, or, in this case, blood flow, the water just drips all the way down into the basement.
The bladder.
Exactly, the bladder. The CC16 leaks from the damaged lungs into the serum and then pours right into the urine.
The leaky roof is a perfect way to visualize it. And those structural damage markers extend to chronic conditions, too.
Like what?
Like for COPD or chronic obstructive pulmonary disease, there is a massive spike in a molecule called desmosine.
Desmosine, what does that do?
Desmosine is a key component of elastin, and elastin is the protein that gives your lungs their rubber band-like stretch.
Oh, man. So when desmosine shows up in the urine?
It means the rubber bands in the lungs are physically snapping.
Oh, that sounds awful. But so helpful for a doctor to know.
Yes, it signals actual tissue destruction during an exacerbation episode. They can even detect volatile organic compounds for lung cancer.
In urine?
Yes. And massive elevations of specific signaling proteins called cytokines for bacterial pneumonia.
Okay, so the lungs oxygenate the blood, but it's the heart that actually pumps it down to the kidney filters.
Right.
Does the urine give us a status report on the pump itself?
The cardiovascular applications are arguably some of the most critical in this whole review, honestly, considering heart disease is the leading cause of death globally.
So what does the urine tell us about the heart?
It provides a remarkably detailed picture of the vascular system. For coronary artery disease, researchers have actually identified specific urinary proteomic panels.
What's a proteomic panel?
Basically, it's a group of 15 different peptides, along with collagen fragments, that accurately flag the disease.
That sounds a lot like checking the oil filter of a car.
How do you mean?
Well, when you take your car to the mechanic, they can look at the oil filter and find these tiny microscopic metal shavings.
Ah, right.
The engine hasn't seized up yet, the car's still driving fine, but those metal shavings tell the mechanic that the internal parts are grinding against each other and a catastrophic failure is imminent.
That is spot on. Those collagen fragments in the urine are the biological equivalent of those metal shavings.
Wow.
They tell us that the structural integrity of your blood vessels is under stress and plaque is building up long before you ever feel any chest pain.
The review also talks about heart attacks, though, myocardial infarctions.
Yes, it does.
It mentions looking at elevated troponin I and heart-type fatty acid binding protein, or HFABP, and it says those spike in the very first minutes of a heart attack.
They do spike very quickly, yes.
But wait,
Yeah.
if I'm having a heart attack, every single second counts. Like, time is tissue, as they say.
True.
Are you telling me an ER doctor is going to hand me a plastic cup and tell me to go use the restroom while I'm actively clutching my chest? Because that does not make practical sense at all.
You've hit on a really crucial distinction there, and it's important to clarify how this technology will actually be used in the real world.
Okay, good, because I was confused.
Yeah, while it is true that markers like HFA-BP do spike in the hyperacute phase of a cardiac event, a urine test is not what the ER doctor will prioritize while your heart is actively failing.
Right, you're doing EKG and drawing blood immediately.
Exactly. The true power of urinary biomarkers for cardiovascular health is in predictive precision medicine. It's about early risk assessment.
Ah, so screening you during, like, a routine physical.
Yes. It's about looking at that 15-peptide panel during your annual checkup and the doctor telling you, hey, your coronary arteries are beginning to show early signs of disease.
Before it becomes an ER visit.
Exactly. It allows us to intervene medically and behaviorally long before that emergency room visit is ever necessary.
That makes way more sense.
We can also detect early risks for strokes by monitoring specific enzymes called matrix metalloproteinases, specifically MMP2.
What do those enzymes actually do?
Think of MMPs as microscopic scissors that cut up the extracellular matrix,
The what?
the scaffolding that essentially holds your blood vessels together.
Oh, got it.
Yeah, so when these enzymes are highly elevated in the urine, it suggests that the vascular scaffolding is unstable, which is a massive warning sign for an ischemic stroke.
It's the ultimate preventative maintenance check.
It really is. They can even look at environmental indicators like your urinary cadmium concentration, which is strongly linked to stroke risk.
So we've tracked the blood from the brain down through the lungs, pumped by the heart, and finally it arrives at the filter itself.
The kidneys.
Yes, the kidneys.
Yeah.
What happens when the kidneys themselves are the problem?
Well, because urine originates in the kidneys, it is the absolute ultimate fluid for diagnosing renal diseases.
Makes sense.
When the kidney is damaged, you don't just see the waste from other organs, you actually see the physical pieces of the kidney itself breaking off and washing away.
Oh, wow. So if the coffee filter tears, you get grounds in your cup.
Exactly what happens. The review explores a host of these complex renal disorders, things like atypical hemolytic uremic syndrome, Alport syndrome, Fabry disease, focal segmental glomerulosclerosis.
Those are some very intimidating names.
They are highly complex diseases, but the mechanism of detection is actually pretty straightforward.
Okay, how so?
The actual filtering units in the kidneys are these microscopic tufts of capillaries called glomeruli.
Glomeruli, okay.
When they are injured, whether that's by genetic defects, inflammation, or fibrosis, they leak components that simply shouldn't be there.
What kind of components are we talking about breaking off?
You start seeing specific chemokines, which are inflammatory signaling proteins, and glycosphingolipids, which are parts of the cell membrane.
It's floating in the urine.
Yeah. And you also see massive amounts of collagen fragments.
Wait, collagen again? Like with the heart?
Exactly, because the kidney's delicate architecture relies really heavily on collagen to hold its shape. So when the tissue scars or degrades, those collagen fibers break down and empty straight into the urine.
That is so direct.
It is. It provides this real-time evidence of renal injury without needing to surgically biopsy the kidney tissue.
Which is amazing. That makes perfect sense. But there's one more application in this review that really, it just completely shifted my perspective.
The prenatal medicine section.
Yes. We spent this whole time talking about filtering out the waste of our own organs, right?
Right.
But what about when a body is growing a completely new body inside it?
Prenatal medicine is truly one of the most profound applications of this entire science.
It blew my mind.
Yeah, maternal urine actually serves as a literal window into neonatal health.
How does that even work?
Well, because the mother's blood and the fetal circulation interact through the placenta, metabolites from the developing fetus cross over and enter the mother's bloodstream.
Okay, and then?
And just like any other molecule in her blood, they are eventually filtered by her kidneys.
So the mother's kidney is essentially printing out a diagnostic report for the baby she's carrying.
It is, and the level of detail is just staggering.
What can they actually see?
The review highlights that elevated metabolites like glycine, hippurate, and tyrosine in the mother's urine point to Down syndrome in the fetus.
Wow.
These metabolites reflect the altered biochemical pathways occurring in the fetus, transferring straight into the maternal urine.
And it goes beyond just genetic conditions too, right?
It does.
Because the research notes they can analyze disrupted lipid-related pathways, specifically looking at metabolites like methionine, I think.
Yes, methionine.
And they can use that to predict congenital heart defects in the unborn baby.
That's right.
Being able to test for a structural heart defect without any invasive probes, without a long needle for amniocentesis, just by analyzing the mother's morning urine. I mean, that is just remarkable.
It completely changes the entire landscape of prenatal care. It reduces the risk of miscarriage associated with invasive testing, and it allows for much, much earlier surgical or medical intervention planning for the baby.
Let's zoom out a bit and try to summarize this, because it's a lot.
It is a lot to take in.
We've taken this simple, completely non-invasive fluid stuff we literally flush away without a second thought and watched it basically unfold into a highly detailed molecular map. We've seen how it tracks cellular debris from the brain, chemical battle scars from the lungs, structural warnings from the heart, torn pieces of the kidney filter, and even the metabolic signature of an unborn child.
We really are moving toward an era where we can gather more data from a non-invasive sample than we ever could from a surgical biopsy or a painful blood draw.
But we do have to remember that giant caveat we discussed earlier, right?
Standardization.
Yes, standardization. Science still has to perfectly calibrate these tests against all the noise of our daily habits.
Right. They need to filter out the asparagus, the beetroots, the dehydration, the morning workouts, all of it, so that the clinical signals are actually crystal clear.
Because right now, the signal-to-noise ratio is tough.
It takes time to build those massive data sets and the algorithms required to account for all those human lifestyle variations.
But assuming they do build them, which they are, it leads me to a final thought for you to just sort of mull over today.
I love these.
We've established that your urine holds a complete real-time molecular data map of your entire body, right?
Correct.
And we know that micro-diagnostic technology, mass spectrometry, and biosensors are shrinking and getting cheaper every single day.
They definitely are.
So if that is true, how long until our home toilets actually become our primary care physicians?
Oh, smart toilet.
Think about it. A smart toilet that analyzes your waste daily, tracks your standardized baseline over years, and automatically pings your doctor's iPad to alert them to a stroke risk or a lung tumor or a failing kidney before you even feel a single symptom.
The data is literally already there in the bowl. We really just need the hardware to read it seamlessly.
It completely reframes how we think about health. You will never have to wait for that painful home invasion of a medical procedure ever again.
Hopefully not.
Your body is already putting the biological trash out on the curb. Soon, we're just going to have the technology to finally read the receipts.